Coming to the next question. A 62-year-old male with type 2 diabetes mellitus presents for routine follow-up. His physical examination is notable for obesity with a BMI of 32, blood pressure of 160/90, fasting glucose is 140, serum cholesterol is 230. Which of the following is most likely to be present in this guy? The patient that you are dealing here is very likely to have a metabolic syndrome, first of all. So what are the components of metabolic syndrome? Number one is central obesity, which is defined as waist circumference more than or equal to 102 centimeters in a male and more than 88 centimeters in a female. And if the patient is having impaired fasting glucose or impaired glucose tolerance or frank type 2 diabetes mellitus, that becomes the second component of metabolic syndrome. And the patient is having a BP of more than 140/90, that is hypertension. That's another component of metabolic syndrome as well. Fourth component is elevated triglycerides of more than 150, and the fifth component is low HDL. This is nothing but a HDL of less than 50 in a female or less than 40 in a male. Out of these 5 components, if you have at least 3, then you can deem the patient to have metabolic syndrome. Even though they have not given the waist circumference here, the patient's BMI is very high, but you can tell the patient is obese, patient is diabetic, and patient is hypertensive. So definitely this patient is suffering from metabolic syndrome. In metabolic syndrome, you expect a low HDL and not a high HDL. So option number A is wrong. And patients with metabolic syndrome tend to have elevated serum homocysteine levels. That is one of the risk factors for atherogenesis and thrombus formation. So option D is also wrong. Patients with metabolic syndrome are known to have high levels of endothelins, which is a risk factor for atherosclerosis and MI. So again, option C is wrong. Option B is correct here. It's a right statement. And patients with diabetes and metabolic syndrome are going to have smaller than normal LDL particles. And this is one of the main reasons why, even if the LDL is in the range of 70 or 80 in a patient with diabetes and especially metabolic syndrome, we are still going to treat them with statins. That's because the LDL particles that is seen in patients with long-standing diabetes and metabolic syndrome are going to be very small, dense, and compact. And they can easily enter the subendothelial area by going through the fenestrations, and they can accelerate the plaque formation. It's a very, very important point. Okay. The right answer for this question is going to be option B.
Subscribe and press the bell icon so you never miss an update from PrepLadder.